I'm Dr. Michael Corey. I'm Clinic Director here at Wellness Stop Chronic Healthcare Center in Tustin, California. And we do an incredible job with our fibromyalgia patients. This is a long process of where you're coming in from and how long you've been suffering and to what degree you've been suffering. But fibromyalgia is a systemic issue, and we need to make sure we take care of it from a core causative basis. So without further ado, let's get into this a little bit. I am Dr. Michael Corey. I'm a doctor of chiropractic for the past 19 years, served in residence of Orange County. I'm board certified chiropractic physician through the National Board of Chiropractic Examiners. Also board certified in integrative medicine. Questions that people always ask is, well, with fibromyalgia, that's muscles and joints and pain, and so yes, it does encompass the musculoskeletal system, but it also encompasses the autonomic nervous system, the peripheral nervous system, and metabolism, and that's what chiropractic is all about. 19 years ago, I had patients coming in with fibromyalgia, and we put together a heck of a program over the last 19 years, changing things around so that we can get the best results possible. Now, with fibromyalgia, what I want you to understand is, just like all chronic conditions, it has some similarities. And these are things that people aren't going to talk to you about, but the similarities with chronic conditions, including the fibromyalgia, your IBS, your Crohn's disease, your type 2 diabetes, celiac disease, thyroid conditions, fibromyalgia and vertigo, insomnia, difficulty sleeping, migraine headaches, ADD, ADHD. All of these things are affected through the nervous system. Your brain's got to be able to communicate from top to bottom, all the way down to the tip of your toes and all the way back up again. Every muscle, cell, tissue, and organ sending trillions of signals on a day-to-day basis to your brain and back down to the tissues has to be occurring and functioning properly. So we have to look at you from a functional neurological perspective. Now, there's two things that we need to get into, and one's fuel and one's activation. So let's just go through this first, and we'll move on from there. But all these conditions that I just reviewed with you, all of those have some common issues with them that are correlated with them, as far as from a dysfunction standpoint. Metabolic imbalances. Hey, your thyroid regulates the metabolism of every muscle, cell, and tissue of your entire body. There is not a fibromyalgia patient who is not also a thyroid patient. I've never seen them in 19 years of practice. Okay, so we have to evaluate thyroid dysfunction, unstable blood sugar, adrenal gland dysfunction, hormone imbalances, autoimmune attacks, hidden infections, yeast, mold, bacteria, virus. What's going on in your system which is interfering with the ability for your body to communicate properly to itself to sustain its health. Food sensitivities, hypoxia, low oxygen, chronic inflammation, and a decreased frequency of firing of the brain. That's right, we are going to evaluate you from a brain-based standpoint. Now, metabolism all starts with the food that you eat. What you put in is what you get out. If you put good food in there, we're going to get good energy. If we're going to put bad food in there, we're going to get bad energy. Have you ever driven in a car that had some water in the gas tank? Well, we don't want you slugging around and not functioning at your best because you're putting the wrong fuel in your tank. Now, 30% of our energy goes to what system? Here's a little quiz for you. What system does 30% of our energy go to? Endocrine system, digestive system, nervous system, immune, or cardiovascular system? And the answer is the nervous system, the brain, the spinal cord, and the nerves. So if you have a metabolic problem and your brain will not work right, because your brain is the most important metabolically active structure in your existence is from a health standpoint, your brain has to have proper metabolic capacity for you to function properly as a human being. So if you have a metabolic problem, your brain will not work right because your brain is the most metabolically active organ in your entire body. Now, all cases are a combination. There's cases of all those conditions that I put up there are all a combination of neurological treatment and metabolic treatment. 60% neurological and 40% metabolic. Okay? So we have to have fuel, and we have to have activation. And we have to have communication from the cortex to muscle cells and tissues in all the structures of your body. So your nervous system consists of your brain, the spinal cord, and the nerves. The brain is your central computer. Think about that, just like your computer. You're using this all day long. or your cell phone. Now they call them smartphones. The nerves, they have to communicate through cables called nerves. There's communication cables are the nerves themselves. And each cell is dependent upon those nerve signals to stay alive and healthy and function. Sending, receiving, interpreting, all that information has to occur through the brain and the nervous system. There's a body-brain connection. Your brain is a sensitive organ, and everything is perceived by the brain. Think about it. It's just there to interpret the information from the external environment. Your brain is one big receptor. Okay, think about it. It's a receptor. Your body is receptor-driven. Your brain stays alive from constant input from your body's receptors and from the fuel in the form of glucose that you take in as fuel. And we have receptors everywhere in our body. Our muscles resist, and those receptors detect gravity. Joints, the positional sense of your muscles in your joints. Skin, through touch. Wind blows by, you can feel it on your skin. Those are receptors that you feel it with. Your eyes, you know, when you walk in from dark to light, your eyes will go from constriction to dilation. And then back again when you go back into a bright light again. Okay, will dilate or they'll constrict again. Your ears from sound, smell with your nose, and taste from your mouth. So your body is a receptor-driven organism, and it's super, super important that you start breaking down things in your mind so these things can make sense to you. Because what we're going to show you is that there's a logical approach towards fibromyalgia and recovering from fibromyalgia. But you have to have the structure in place and the foundation there in order for you to get well. So body-brain connection. And the question, which two receptors light up the brain the most? And the answer is touch and gravity. So all of your receptors and gravitational forces on the spine and all those receptors are all what gives you the most input to the brain. Three parts of the brain that we want to discuss with you is we want to talk to you about the cerebellum. Accuracy, balance, and coordination is what the cerebellum does. We want to talk to you about the cerebrum, the cerebral cortex. We've got the temporal lobe, we've got the parietal lobe. Parietal lobe has a somatosensory cortex, which is what lets you detect what's going on that left side of the body over to the right brain, and what's going on that right side of the body to the left brain. So everything's crossed over. And let's see, look at this one here. And then we want to look at the brainstem itself, which is down here. And so brainstem is very, very important. Now, how does the brain work? Sensory input from the body goes to the same side cerebellum first. Okay? So sensory input from the body goes to the same side cerebellum first. It is then sent to the opposite side of the upper brain, okay, to the parietal lobe, like I talked to you about, the temporal lobe or the occipital lobe. The upper brain has a major connection to all of these areas, including the brain stem. The brain stem inhibits, means puts the brakes on, it slows things down. The biggest job of the brain is to slow signals down, to interpret them, to get that communication. Brain stem inhibits or puts the brakes on, keeps under control our sympathetic fight or flight response. So our fight and flight response, if you have a lion chasing you, your heart's going to immediately speed up, you're going to get anxious, you breathe faster. That's an autonomic response. Without this braking system, our sympathetic nervous system creates a lot of chronic conditions because we have stopped regulating how things are working in the body. It just continues to fire and fire and fire. We want to make sure that we can put the brakes on that lower area. And get a little problem with my button here. Let's go back here. And so, okay. An overfiring sympathetic nervous system, on the other hand, can cause chronic pain and chronic fatigue, okay, irritable bowel syndrome, okay, urinary tract infections, fibromyalgia, migraine and tension headaches, poor posture, and adrenal gland stimulation. Okay, all these things will play a part. Now, overfiring of the sympathetic nervous system overfiring will cause blurred vision, increased sweating, difficulty falling or staying asleep. How many of you are experiencing insomnia? How many of you are experiencing difficulty falling asleep or staying asleep or even after a good night's sleep, you're feeling exhausted throughout the following day. Okay, overfiring sympathetics can cause this. Difficulty falling or staying asleep, dizziness and vertigo, heart palpitations, cold hands and cold feet. Okay, sensitivity to light and sound. Sometimes light is just too bright for you. It's, sound is just, you can't go to a movie because the sound is just way too loud. Or children, or kid crying can really bother you because you just can't compensate for that increased volume. The cerebellum fatigues, and when the cerebellum fatigues, we have a loss of balance. We can have vertigo, we have chronic neck and back pain, we can have headaches, we can have clumsiness or dropping things. The cerebellum controls that, your coordination and your ability to have dexterity. Disorganized thinking, and lack of output to the upper brain. The lower brainstem fires to the upper brain to give you more information so you can interpret that information through the frontal lobe, the parietal lobe, the temporal lobe, or the occipital lobe in the back. Now, frontal, parietal, and temporal lobe fatigue results in a lack of inhibition of the sympathetic nervous system. Going back to, you're not getting enough input from the occipital, from the temporal, or from the parietal lobes. It doesn't fire back up to the cortex to give you feedback down to regulate that fight or flight response. Upper brainstem fatigue can cause depression, anxiety, difficulty scanning pages while reading, difficulty adding or subtracting, difficulty with verbal expression, difficulty understanding language. We have Broca's or Wernicke area that you have to have that input to be able to have and make sense and be able to regulate what that information really means to you. So, decreased memory, learning difficulties, and lack of focus. You can also have altered sensation, numbness and tingling, changes in your handwriting, anger or increased irritability in situations where you normally wouldn't have been. Body weakness, we can have lack of motivation, we can have learning disability, ADD, ADHD, dyslexia. This is a concomitant, cumulative problem. It's not just one thing. Remember, fuel and activation, but we're looking at the lower brainstem, we're looking at the upper brainstem, we're looking at the lobes of the brain. Overfiring of the mesencephalon, which is in the higher area of the cord, goes to the spinal cord. We go to the adrenal medulla, which is sit on top of the kidneys. The adrenal medulla releases catecholamines, and norepinephrine is released in the bloodstream. And then we get type C fibers affected, which are nociceptive pain fibers, pain nerves. Those fibers are activated, and that causes your chronic pain from fibromyalgia. This will cause fatigue due to your loss of sleep. And there we go. Let me go back over here. And as that overfiring of the mesencephalon occurs, we will go through and we'll have stimulation to the mesencephalic reticular activating system, which would produce a high firing rate at 3 in the morning, which would keep you awake and cause insomnia. But if we have a low firing rate, then we're going to produce fatigue with that. So I want you to understand that there is a big difference between those. We have emotional stress causing hypothalamus, which controls pain and temperature, releases corticotropins, releasing factors, which then stimulates the pituitary gland, and that releases acetylcholine. Now, acetylcholine, in turn, we're going to look at the adrenal medulla, releasing cortisol, which is toxic to the brain. So cortisol is toxic to the brain. It's going to cause inflammation. Inflammation, we're going to end up with some memory loss, we're going to have problems focusing, and then this is what constitutes that what we call fibromyalgia fog, or fibro fog, where you just can't think clearly. You feel like you're walking around in a cloud all day, and there is no clarity of your thought or of your process. So overfiring of the mesencephalon will cause blood vessels in the brain to dilate, nerve mesh around the blood vessels to become irritated, and it can cause migraine headaches as well. So how does all this happen? Well, we need to look at some factors. We need to look at chemical stress, physical stress, emotional stress. All those cause the brain to fatigue. Now, put yourself under any of those stresses individually, and you're going to be fatigued. put yourself under all of those stresses simultaneously. And we have a big problem. I mean, this is a disaster in motion when we have chemical, physical, and emotional stress causing the brain to not function properly. We end up getting fewer nerve impulses, and with fewer nerve impulses, we're going to have dysfunction of the regulatory systems in your body. Chemical and physical stress to the brain. This includes anemia, too little oxygen. If you don't have enough oxygen in your blood, and enough red blood cells circulating in your system, you can't carry the oxygen to the cells. We can't have that, so we're going to have a decrease in oxygenation, producing anemia. Blood sugar imbalances with your glucose, food sensitivities, gluten, casein. We can have dairy, we can have soy. So all of those issues have to be taken care of and identified. Immune system imbalances. Are you autoimmune? Well, we're going to do a special test on your blood test when we run the blood test to find out if you indeed are autoimmune. Poor diet will contribute, causing inflammation, omega-6 to omega-3 fatty acid ratios to be thrown off. Hypothyroid function, weight gain, lethargic. If this rings a bell, we definitely have to look at the thyroid. Prescription or non-prescription drugs that you're taking. Look, folks, you watch the commercials as much as I have seen the commercials on TV. You get trade hay fever for diarrhea, constipation, vomiting, diarrhea, and then it ends up with death. Okay, so all these quote-unquote scientific medications you're taking out there, they all have side effects. Well, I don't look at those as side effects. Those are primary effects, especially when they happen to you. So what I want you to understand is that if we can get to the core cause of why you're sick in the first place, then we're going to be on great grounds to help you lead a long and healthful and fruitful life so you can pursue the dreams, goals, wants, and desires that you have. Hidden infections are a big thing. Inflammation is one thing that I have to get control over and help you get control over in your life in order for you to recover. With inflammation, there's nothing that we can do to help you if you are inflamed on a regular basis. We have to get control of the inflammation, find out what those triggers are, and get you to a corrected state. These are metabolic problems that create nervous system imbalances in the brain. So just a few. I put this PowerPoint presentation together so that I didn't go off on too many tangents. So that's the reason why we use PowerPoint. Emotional stress to the brain. We have to look at the adrenal glands. Adrenals will secrete cortisol, creates anti-insulin effect to the tissues, raises your blood sugar. Blood sugar goes too high, we're going to have problems as well. High triglycerides, LDL, and cholesterol levels. Inflammation is the causative factor with all of these conditions. We have to get rid of inflammation, otherwise your cholesterol will cause problems, and that's when your doctor wants to put you on statins, which in turn causes more problems. It's a roller coaster. We want to make sure that we get you off that roller coaster or off that wheel like a rat is running around, and what we want to do is we want to make sure that we can walk on 2 feet, breathe with our lungs, see with our eyes, smell with our nose, have all of our senses intact, and we want to make sure that we do that without causing toxicity, which is what medications in general do. High insulin and glucose levels cause breakdown of your brain and of their nerves. Ladies and gentlemen, the days of taking a magic pill are over with. We have to go back and look at the foundation. This is what I've done for 19 years, is look at the foundation of what builds health with the individual and going back and resetting the foundation for the individual in our office so that we can help you overcome the problem. Chronic conditions do not get better by themselves. The longer you have a chronic condition, the faster your brain dies. The Journal of Neuroscience reports that the McGill University Center of Research on Pain has found the longer the individual has had fibromyalgia, the greater the gray matter loss, that's the area of your brain, the tissue in your brain, the greater the gray matter loss with each year of fibromyalgia being equivalent to 9.5 times the loss in normal aging. 9.5 times the normal loss in aging. In addition, it is estimated that 30 to 60% of patients diagnosed with fibromyalgia become disabled to a degree that they cannot remain gainfully employed. And that is within the myriad of medications prescribed. You're taking pain relievers, muscle relaxants, sleep aids. I mean, the list goes on that my patients have come in with. And I don't want you to be one of them. I want you to make sure that we can get to the core cause of this, get this under wraps, and get you back to a healthy, functional life again. So how is brain-based therapy different? Well, we look at something called neuroplasticity. Neuroplasticity, of all the finds through, though, one is rewriting the textbooks. It is a dawning realization that the brain older than 3 years old is not the rigid structure that we used to think that it was, but a malleable plastic organ. But a flood of discoveries show that the brain continually reorganizes itself. It's called neuroplasticity. So if your brain has one connection to one neuron on each side, what neuroplasticity is, with repetition of firing those pathways, what we see is that now we can have another connection. Then we can have another connection. Okay, so we'll go from one connection to two, and then we can connect. Then we have three. Then we have four. So neuroplasticity is the process of your brain being able to learn new tasks, to reiterate and ingrain those pathways, so your brain knows how to fire and where to function from. The work of Dr. Frederick Carrick, through the Carrick Institute of Neurology, he's laid the foundational work for all of this learning. Look for the Carrick Institute if you want to go through YouTube. They've got a number of videos on there. But just, he's a genius. He's a functional medicine genius, and his functional neurology is second to none. Great innovator of our time, and boy, functional neurology wouldn't have anything if it wasn't for Dr. Carrick. Key points of neuroplasticity. Your brain changes when stimulated, okay? Number one, it changes when it's stimulated. No different than if a child goes in and starts to read. Okay, we start to ingrain the pathway. Riding a bike, the first time you needed wheels, you take those training wheels off. Now a child can ride, or an adult can ride without training wheels. That's neuroplasticity. We're learning. Different types of stimulation help different areas of your brain. So the cerebellum in the brain requires two things to function properly: fuel and activation. Remember, we talked about glucose is a fuel and oxygen. That's a fuel that your body needs. And we need activation, or brain exercises. So fuel plus oxygen equals a functioning human being. We need fuel and activation. Therapy is used for brain activation. We use an upper body ergometer with concentrated oxygen, and this is delivering fuel to the system. Oxygen concentrators deliver 90% pure oxygen while it's used while exercising. It activates the cerebellum, provides fuel and activation to the cerebellum. Accuracy, balance, and coordination is what your cerebellum does. It interprets all that information of sensory input back to the brain again. So we want to make sure we wake that baby up. We want to make sure that you're getting enough oxygen and activation. We also use vibration therapy on one side of the body. Remember, your brain might not be firing equally, so we want to make sure that if you're deficit and you're not functioning and you're not getting stimulation to that left side of the brain, we want to use activation, we want to use vibration, we want to use neurological adjustments, warm calorics, balance therapy to help you with that. Muscle retraining, auricular therapy, or olfactory stimulation. So we use all of your senses to help fire those pathways to get you to function back. For brain activation, visual auditory stimulation, we can use color lenses, we can use pictures of faces, familiar and unfamiliar faces, eye exercises, maze, word searches, large letters made of small letters, sounds in certain frequencies, nature versus a metronome or a Mozart. All of those are going to fire the brain differently, and we need to make sure that we put you on the right treatment program so that we can fire the correct pathways to help decrease that mesencephalic stimulation. We just can't put the brakes on. Remember how we talked about that? Metabolic disorders causing brain imbalances. Anemia, okay? If you can't deliver oxygen, we're going to have a problem. Blood sugar imbalances, food sensitivity, immune system imbalances, adrenal gland disorders, thyroid dysfunction, inflammation, and hidden infections. So how do you know if you have one or more or all of these? Well, we have to do proper testing. Testing is super important. We need to find out what the slate is, get a baseline picture of exactly how you're functioning, and that's what the lab test does. But lab tests alone are not important, because it's how you read or interpret that information from the lab which will designate whether or not you're successful or you fail your desired outcome when it comes to your health. Now, there's a big problem with health and how we evaluate. We don't want to evaluate you from a sickness model, we want to evaluate you from a health model. Have you been told your lab tests are all normal, but you continue to have the same symptoms? The doctor says everything's in check. Well, lab ranges are inaccurate. They use a bell-shaped curve when they evaluate that. So you might remember that bell-shaped curve when you were in school. That bell-shaped curve comes up to the peak and it drops back down, so on equal ends. Functional lab values are more sensitive to reveal the problem. What I mean by that is that when you remember the bell-shaped curve is going to come up and it's going to come back down and it's going to drop back down. These are abnormally low values over on the ends in red. In these areas you'll find lab findings that a doctor will say are normal, but they are not, and that's what I want you to understand. To use specific numbers, your glucose level, for example, which is your blood sugar, functional range is 85 to 100, which the laboratory range that your doctor uses is 65 to 110, so they're evaluating here. Remember that peak, they're evaluating you out here, that peak comes up in the middle, and we want to bring it into the functional range of 85 to 100 so that we can look at you from a healthy perspective, not one comparing you to diseased people, which is what that average comes out to. TSH, thyroid stimulating hormone. The thyroid is very, very important to every bit of your metabolism. Never had a fibromyalgia patient that didn't have thyroid problems. The functional range is 1.8 to 3. Your doctor is going to use 0.3 to 5.7, big wide range. We want to bring that 0.3 to 5.7 down to 1.8 to 3. And we're going to look at where healthy individuals are. Then we'll look at your blood test and evaluate how healthy you are. Cholesterol, triglycerides, hemoglobin, all those things in all those parts of your lab test can be evaluated from a functional perspective. Okay, super, super important. Metabolic treatments. This is one major reason why we're getting chronic patients better. We're simply running the necessary tests to diagnose a patient appropriately. Okay, this is vastly different from your PPO and HMO model. Ask yourself this: how long have I been going to my PPO or HMO doctor, and why am I still suffering? You know, ladies and gentlemen, if you're continuing to get the same thing over and over and you're not resolving the problem, somebody's got to look somewhere else because they're not getting the puzzle pieces put back together. Based on your history, we may run any of the following tests and look at functional values. We're going to run a complete blood chemistry panel, including your thyroid markers, your HA1C, your lipids, your complete blood count, and with differential. We're going to look at your salivary hormones. We're going to look at your adrenal function through the salivary test. We're going to do a stool ecology test to see if you have poor gut flora. You might have bacteria, you might have virus, you might have parasites. We use a company called Cyrex Lab Testing. They will perform food sensitivity testing for gluten and multiple other foods. Okay, super, super important. You know, gluten is one of the prominent problems in our fuel supply because as we do this, as we go through and we eat our daily healthy meal, we have to understand that we have genetically modified food out there. Monsanto has messed up our food supply big time. Look it up, look on the internet, delve in, find out what's going on with your health and what foods are good to eat, which ones aren't good to eat. But we need to find out if you have food sensitivities and if you are sensitive to gluten, soy, rice, corn, all those are on our food testing that we do. We want to check and see if you have something called leaky gut syndrome. Leaky gut syndrome will prohibit you from getting the nutrients from your digestive tract and getting that into the bloodstream so your body can utilize it for fuel. Yeast, mold, parasites, and bacteria. Okay, if you've got leaky gut, you've got parasites on top of it, man, that's a double whammy. You're just not going to get better. Autoimmune testing to include measuring to see if your immune system is mistakenly attacking over 90 different tissues in your body. This antibody testing is super, super important for us to get you well. How many of you have had any or all of these tests performed? Not many. I've never had anybody come in with these tests already done. Now, neurological breakdown with metabolic complications. So, ladies and gentlemen, I want you to understand, as I mentioned in the very, very beginning of this presentation, your body has issues that need to have things working consistently so that all those pieces can come together. We've got the cerebellum, accuracy, balance, and coordination. We've got blood sugar to deliver oxygen to the cells. We've got your hormones to regulate your hormones in your cycles. Your midbrain function, your upper brain stem function of the mesencephalon. Is that overfiring or underfiring? Are you having oxygen issues? Is your cortisol levels too high? You know, all these things have to be put together, and we need to correct the underlying causes of the problem. And we also have to do periodic retesting, and this lets us know that we're on the right track. So as we put those pieces together, we want to make sure the cortisol, the cerebellum, midbrain, oxygen deficit, any hormone problem or any blood sugar problems are corrected. You know, if we bring those all together and we treat the whole person, we get great results and patients are happy because we put things together. Now, you might ask, well, what's next, doc? Well, the next step for you is to make an appointment. And I'm going to outline exactly what you'll get as part of that appointment. First 2 visits are outlined here. We're going to do a complete neurological evaluation. We're going to do a review of your existing lab. If you haven't had labs done, you can call the office prior. We can order the labs, and then when we sit down, we can discuss those labs with you. But bring the existing labs that your doctor has already run. Remember, if your doctor knew what they were supposed to be running, they'd run the labs that we're looking for when you come in. So bring those labs, let's see what they've been doing with you. Fill out metabolic assessment form and neurotransmitter assessment form, which we will provide with you when you call and make an appointment. Must be with spouse or significant other on that first visit. Super important. I want you to have the support system is set in place before you start our program. It's super important in that way. Visit 2, we're going to do a case review, if I accept your case or not. Overview of further complete testing to be done. We need to run the food sensitivity test or the leaky gut test. We're going to do that. We'll set you up on the second visit to have that test done. Review neurological findings from visit 1. Remember, visit 1 we did the examination. Visit 2 we're going to talk to you about, let you know what the findings are and interpretation of that. We're going to give you an overview of the treatment plan, the recommendation of your care plan, review any financial obligations that you have, and you must be with your spouse or loved one during this visit as well. Like I said, support structure is everything. We want to make sure that people don't stop just because somebody in the family doesn't understand what's going on and what it's going to take to get better. So my offer is I only accept 5 new fibromyalgia patients on a month-to-month basis. These 2 first visits normally will cost $450 if I charge you a regular rate. If you make an appointment after watching this video, I'm going to offer you the visit 1 and visit 2. We're going to offer both of these to you for $60. Okay? If I feel that I can't help you, I'm going to refund your money. If I don't feel in my heart that I can actually help you become a healthier individual and help you overcome this issue and these health complaints that you're coming in to see me for, I will refund your examination fee. Okay? I want to make sure you get in the proper hands, make sure that you can get to the proper doctor to make sure you take care of this. One thing that we do need to talk about is your commitment level. Your commitment level is of the utmost importance. I've got 3 rules in accepting a patient for care. Okay? First is you must be willing to make serious life changes with your lifestyle. Your exercise level, your ability to eat properly, to not continue causing the problems that you're coming in to see me for. You must take accountability and responsibility for your health. And number 3, insurance and Medicare only pays a small portion of the fees for our program. We have made our care plans in a way that over 96% of people that see us for an examination can afford the care that we provide and help them recover. This can cost as little as $200 to $400 on a month-to-month basis, and we will help you out as far as getting that either finance or else we'll help you internally here in the office. But you have to understand, you have to take responsibility, you have to be 100% committed, and you need to take responsibility for finances and understand that insurance is not going to cover 100% of this type of care. The reason why you're still sick is because mainstream medicine, you can't correct the problem with a pill. On a scale from 1 through 10, how has this condition of fibromyalgia affected your relationships, affected your work, your ability to enjoy your life on a day-to-day basis. On a scale of 1 to 10, how serious are you about eliminating the condition? Do you want to get better? You know, believe me, I've had some patients that just obviously did not want to get better. They didn't want to even do some of the things once they heard about how to correct the problem. They didn't go through and want to follow through. Due to time constraints, I can only accept those who are truly committed to the condition. I do want to make sure that I get great results with you. I want to make sure that you can follow through. I'm going to give you the utmost best guidance possible, and we've got the tools to get you well. Thank you very much for watching this presentation. If you have any questions whatsoever, you can email me at askdrcorey@wellnessstop.com. That is ASKDRCOREY at wellnessstop.com. WELLNESSSTOP.com. Or else you can call our office at 714-730-5833. I'm Dr. Michael Corey, and thank you very much for letting me spend this time with you during this presentation. Have a great day, and I look forward to helping you.